Injection techniques. The gastrointestinal tract is the ideal route for most medications. However, it can have some distinct disadvantages, including slow variable absorption and the ability to inactivate, digest some medications. The advantages of administering an injection include rapid action. The drug may not be available in oral form. Patients who are nil by mouth and certain drugs are destroyed by the digestive processes in the stomach, such as insulin. Injection administration can also be used to administer long-acting, depot medications for maintenance therapy. Injections administered through intramuscular or subcutaneous routes allows the drug to enter through muscle or subcutaneous tissue, where it passes through gaps in between cells into the capillary walls, moving into the general circulation or target organs, bypassing GI tract absorption. 5 rights of drug administration. Step 1. Right patient. Are you certain that you are giving this drug to the right patient? Check for any allergies, hypersensitivities, or adverse drug reactions from medications given before and check their clinical observations to make sure their drug is clinically indicated. Assessing the patient's condition before and after the drug is given. Step 2. Right medication. Drug. Are you certain that this is the right drug for this individual? Is it the correct name and strength on the medication label? Step 3. Right dose. Are you sure that this is the right amount of that drug for this individual? Check dose on the clinical guideline. Ensure you have read the guideline of the JR Calc table correctly to reduce any chances drug administration errors. Step 4. Right route. Are you sure this is the right place or way to administer this drug for this individual? Can the medicine be given by the route? Is the route in your scope of practice? Is it suitable for the patient and the reason for the medicine? Step 5. Right time. Are you sure that this is the right time to provide this drug to this individual? Compare the time in the Cardex. Never administer additional or missed doses. Equipment needed to administer medication through an injection include a syringe, the smallest syringe that will accommodate the medication volume, injecting needle, drawing up needle, also known as a blunt filter needle, filters out subvisible particles of glass, rubber and other residues when drawing up medications from ampoules, gauze, alcohol wipes, and medication. Intramuscular injection. There are 4 sites on your body that can be used to give the patient an intramuscular injection. The upper arm, known as the deltoid, the thigh, also known as the rectus femoris and vastus lateralis, the hip, also known as the ventrogluteal, and the buttocks are also known as the dorslgluteal. Procedure. Check medication. Draw up medication using a drawing up needle. Dispose of the drawing up needle immediately. Attach the injection needle to the syringe. Position patient depending on which site you will be using. If you are using the deltoid, get patient to sit down to reduce the risk of any injury should they collapse. When finding the site at the deltoid, palpate the lower edge of the acromial process and aim to inject 2.5 centimeters below this area. Clean injection site for 30 seconds and allow it to dry, following local policy and guidelines. Apply gentle traction of the site using the Z-track method to help prevent any medication entering the subcutaneous layer. Insert the needle at 90 degrees with bevel facing up. When injecting into the dorslgluteal site, it is best practice to aspirate the needle prior to giving medication, as there is an increased risk of entering a blood vessel in that site, such as the gluteal artery and the sciatic nerve. Inject the medication into the site slowly over 10 seconds. Remove the needle and activate the safety device if applicable and release traction. Apply gentle pressure to site, dispose of sharps. Apply plaster. Subcutaneous injection. The drug needs to be injected into the fatty tissue just below the skin. The most common injection sites are the abdomen, at or under the level of the belly button, about 2 inches away from the navel, the arm, back or side of the upper arm or the thigh, front of the thigh. Procedure. Check medication. Draw up medication using a drawing up needle. Once completed, dispose of the drawing up needle safely into a sharps bin. Attach the needle to be used for the subcutaneous injection. Choose the appropriate injection site and clean the area of skin following local guidelines. Safely remove the needle cover. Remove any air bubbles prior to administering the medication. Bunch the patient's skin between your thumb and index finger with your non-dominant hand. This lifts up the adipose tissue. Insert the needle at 45 to 90 degrees with the bevel facing upwards. Inject the contents of the syringe into the subcutaneous tissue. Withdraw the needle. Apply gentle pressure over the injection site. Apply plaster. Dispose of needle in sharps container. Subscribe to the channel for more.